Hi everyone. Endometriosis is a problematic condition that can cause untold pain and suffering adolescents and adults alike. It can be difficult to diagnose because there's no blood test to diagnose it, and endometriosis isn't always visible on imaging, whether ultrasound or MRI scans. I was doing an operation the other day for a 15-year-old who had pelvic pain, who I suspected had endometriosis. And when she was on the operating table, I cleaned her tummy, her abdomen, as we do before operating. I looked at it and I said, I'm pretty sure I'm going to find endometriosis. And that's because she had a sign on her abdomen, which is a telltale sign for endometriosis, particularly I think in adolescence. And actually, it's a sign that you can look for yourself on your own abdomen or that of your daughter, for example. So, what is this that I saw? It's a skin appearance called erythema ab igni, which means in Latin redness from fire. And the appearance on the skin is caused by prolonged chronic exposure to heat or a heat source. I'll show you an image of what it looks like. And actually, this girl and her parents were so keen to help other teenagers that they were happy for me to use this image to show others what it looks like. So I'll describe what it looks like first of all. It looks like a net-like pattern, which is initially red, but as time passes and there is more and more exposure to heat on the area, the net-like pattern can become hyperpigmented, so there can be pigmentation. The size and shape of the area is usually approximates the size and shape of the heat source. As time goes on, the skin may become thinner, and in mild cases, it may resolve after a few months, but of course, the heat source has to be taken away. And in more severe cases, the appearance may be persistent, which really is a shame, particularly in a young adolescent teenager becoming a young woman. So I think that we need to take this seriously as a potential sign for endometriosis. And if you saw my video about teen endometriosis, you will see that the thumbnail is me throwing a hot water bottle because there is such a high correlation. I see so many adolescents who use a hot water bottle repeatedly over a long period of time before their diagnosis. This is what the appearance looks like. And as you can see, there is a well demarcated area on the lower abdomen or pelvic area, and that's where the pain arises in endometriosis. So this is something that you can easily look for, as I said, in your child or even in yourself if you've got a history of pelvic pain. And I think the fact that this heat source is being used so often, such a long period of time, that it has time to initiate these skin changes. I think it's so important that we think, could this be endometriosis, and do the necessary investigations. As again, you can see from the image, this is post-operative. She's had a laparoscopy, and I did unsurprisingly find endometriosis, which I removed at the time. Hopefully this will sort her pain, and she can get back to living an active life, not missing school, etc. Easy to check on yourself or your daughter. I really think this needs to be taken seriously, because even if the patient does not have endometriosis, even if we do a laparoscopy and we don't find endometriosis, then it rules that out as a cause for her pain, and we can focus on other issues that can be the cause of her pain. But this sign means that her pain is severe enough that really we need to get to the bottom of it, whatever it is. so that she can recover, she can retain her life, her activities, things she enjoys, and of course her skin can recover so she doesn't have this appearance on her skin in the longer term. Thanks for listening.